A very good morning to one and all. Today we are discussing about another topic, that is speech defects and speech therapy. Let me introduce the topic. Speech and language disorders can affect a person's ability to talk, understand, read, and write. Children may develop speech or language disorders due to conditions that affect brain development before, during, or after birth. Adults may develop speech or language disorders due to stroke, traumatic brain injury, or brain tumors. Many people with these disorders can benefit from treatment. This reference summary discusses speech and language disorder. It includes information about the symptoms, causes, diagnosis, and treatment of speech and language disorder. So, speech and language disorder means it's a main problem which can affect the person's ability to talk, understand, read, and write. If you can't able to speak, or if you can't able to produce the language or proper words, then it will be a difficulty for talking, to communicate with others, to understand some. If you don't know about the words and all, then it is very difficult to understand, and even though you can't able to read and write, so it is a main is a one of the main problem which can affect your communication. So it is mainly developing in children's and even in adults also. In children's, mainly due to any birth defects or any congenital anomalies. Okay, and in adult, this is occurring due to any stroke or any brain injury or brain tumors due to this particular conditions. In adults also, this speech disorder can occur. In any age group, it can occur. Today we are discussing about what are the speech defects, what are the causes, what are the signs and symptoms, diagnosis, and management of these speech disorders. So we will go in detail. First of all, we'll discuss about the process of speech, how the speech is occurring. In the first process, you can see in the left side, it is hearing. Hearing is one of the main, the first process of speech. Yeah. Before starting speech, we have to hear properly. Then we have to understand what you hear. Then we have to thought and word processing. Then we have to construct the words or the speech in your mind. Okay, what should talk with others. Okay, then voice production. The next one is voice production, that we are going to start speaking. And articulation means pronunciation. Okay, proper pronunciation. So these are the things, or step by step process comes under speech. And in abnormalities means, if you are deaf, then you can't able to hear. If you are having aphasia, is language disorder. If you are language defect, if you can't able to understand the words properly, then again aphasia. Then dysphonia, you can't able to produce the sound properly. And dysarthria, okay, difficulty in pronounce. Okay, so these are the abnormalities you can see in process of speech. Let us see what are the speech disorders. First of all, definition. Speech disorders or speech impediments are a type of communication disorder where normal speech is disrupted. So, when the normal speech is disrupted, that we can call it a speech disorder or speech impediments. In that, there are a type of communication disorders are there. Okay, there are so many type of communication disorders are there, not a single one. So due to any of this communication disorder, if you can't able to complete your speak, or your speech, that we can call it a speech disorder or speech impediments. Let us see what are the common speech defects. Stuttering or stammering. Okay, stammering and stuttering both are same. Cluttering, then dysprosody, muteness, articulation disorder or phonetic disorder, phonemic disorder, voice disorders, dysarthria, and apraxia. So these are the main classification of speech disorders. Let us see one by one. First, we will discuss about stuttering. What do you mean by stuttering? It is the most common fluency disorder. Is an interruption in the flow of speaking. Fluency means what? The proper flow of the speaking. So when we are talking, in between the talk, if there is no break or if there is no incontinuity, that we can call it as proper fluency. in between, if for example in between the speak, if you are you are searching for some words, or you are thinking about some pronunciation or words, so that particular thing we can call it as disfluency, okay, or there is some breakage is occurring. So it is a stuttering or stammering is a fluency disorder where there is an interruption or a break is occurring on the speaking. While you are speaking, in between you are having a break. Okay, example, for asking where are you going, where are you going, like that. So that where, okay, for constructing the where, there is some delay or there is some interruption is occurring, that is called stuttering. So you can see here, while talking in that comment box, you can, we know you mean will, but we just need a little more time to say what we would like to say. So in that you can see that so many breakage is there. Okay, don't finish someone's sentence if they are stuttering. Okay, so that is another comment. So in the comment box you can see that there is so many breakages for producing mean, but, then little, more, what. So in these words you are having some kind of disruptions or interruptions are there, that we can call it as stuttering. Second one is cluttering, is an extension of normal speech disfluencies. Okay, so here the normal speech is there, but there is some extension of the speech. Okay, when we are talking that time, you are taking too much extension. Okay, there is no fluency in that particular, okay, or there is no order in that particular speech. Okay, so example, I want to go to, instead of that one, I like that it is going. Okay, so that is the difference of cluttering. Then next one, so here you can see the difference of cluttering. In stuttering there is an order is there, but in cluttering there is a disorganized. Okay, you can see in that there is some disorganized manner. Okay, so in that example also you can do, the store is over, to the store, I want to go to the, I need the store is over to the store, means there is so many disorganized. Okay, so that sentence is not organized. Okay, that person want to go to the store, but he is telling that I want to go to the store, I need, the store is over to the store. Okay, like that, some kind of disorganized manner, that is called cluttering. Next one, dysprosody. Dysprosody, it is characterized by alteration in intensity, in the timing of utterance segments, and in rhythm, cadence, and intonance. Okay, cadence means melody or harmony. Intonation of words. Intonation means variation in pitch of voice. So dysprosody means there is an alteration in intensity, in the timing of utterance segments, and in rhythm. So one, when we are talking that time, there is some alteration is occurring on the rhythm of the speech. Okay, there is an in between the speech, high low pitch, like that, some changes will be there. So the rhythm, the particular talking rhythm is changing, and also there is some variation in pitch of voice. Okay, high, sometimes high pitch, then low pitch, then again high pitch. That particular melody is not there for talking, for example for songs or for a good speech and all. There is a rhythm or there is a melody or harmony is there, so that particular disruption is occurring, that is called dysprosody. What is wrong with me? So here there are so many prosody is there, the proper letter formation is not there. Next one is muteness. Muteness means complete inability to speak. The person can't able to, we can call it as dumb. Okay, they can't able to speak anything. Then next one, articulation disorder. Articulation disorder means pronunciation problem. So we can call it as phonetic disorder. They are characterized by difficulty learning to produce sound physically. So they can't able to produce a sound physically. Means they are producing, but the proper pronunciation is not coming. Sounds can be substituted, left off, added, or changed. So sometimes they are substituting some left off sound. Okay, so for example, in some we also know in some words, some particular alphabets are absent. Okay, so sometimes when you are, some people are pronouncing that absent word also along with this particular thing. For example, when we are talking asthma, some people are asthma, in that t h is silent, but some people are pronouncing asthma. So that is a pronunciation or phonetic disorder. they are not properly, they are not pronouncing it properly, then these errors may make it hard for people to understand what a person want to say. So if they are having pronunciation problem, then it's very difficult to understand what they are talking, or the receiver, or the person who is the person to whom you are speaking, the person is having difficult to understand, okay, or the opposite person is having difficult to understand what you are conveying. Many persons with this effect defect sound like they are making a W sound for an R sound, that is wabbit for rabbit, okay. Instead of rabbit they are producing wabbit, okay. So that is a pronunciation mistake is there. And for banana they are producing nana. So that is called phonetic disorder. There is some difficulty to produce sound physically, or difficulty to pronounce the sound properly. Then, so you can see an example for cat. People, children are sometimes they are pronouncing tat. Okay, so instead of C, they are producing T. Okay, they are repeating the T. Okay, then phonemic disorder means phonetic and phonemic. Phonemic means they are characterized by difficulty in learning the sound distinction of a language. So phonetic means difficulty to produce the proper pronunciation or proper sound, and phonemic means they can't. There is a difficulty in learning the sound distinction of a language. There is an inability to understand the differences of the sound or language for particular word. When we are hearing that time, we are some kind of inability is there to understand the exact pronunciation, so that we can call it as phonemic disorder, so that one sound may be used in place of many. So here example they are giving: substituting all sounds made in the back of the mouth like K and G for those in front of the mouth like T and D. Okay, sometimes they are saying tub for cup. Okay, instead of cup they are saying tub, and for das they are telling gas. So they are keeping some for D they are keeping G, instead of G they are keeping K. So some language problem is there with these people, so they can't able to identify the differences in a language, so that we can call it as phonemic disorder. They are characterized by difficulty in learning the sound distinction of a language, okay. So they are producing one sound instead of one sound in place of many, okay. In many places they are using the same sound. So some of the your friends also using E for special, they are talking a special, okay. For particular things they are using E or S, okay. So that is also a thing which we are learned. They can't able to identify the difference of this particular thing. Next is a voice disorders. They are impairments, often physical, that involve the function of the larynx or vocal resonance. Okay, voice disorders are also impairment, that are also speech impairments, often physical. It is occurring due to physical defects or changes involve the function of larynx or vocal resonance. The mainly voice disorders are mainly occurring due to the physical changes in the vocal cord or larynx. Okay, mostly characterized by hoarseness of voice, vocal cord nodules, vocal misuse and abuse. Okay, so this also we can call it as voice disorder. Hoarseness is also a voice disorder. Muffling sound, that is also a voice disorder. Then excessive or loud talking, that is also a voice disorders. So here you can see in the normal vocal cord and inflamed vocal cord. Due to the inflamed vocal cord only this voice disorders are occurring. Here vocal cord lesions you can see. Because of this lesion also voice disorder can occur. Then next one is dysarthria. Dysarthria means defects in producing of sound or difficulty to produce sound. It is a weakness or paralysis of speech muscles caused by damage to the nerves and brain. Okay, so dysarthria is mainly occurring when there is a damage or when there is a defect is occurring on the brain or nerve. So that can lead to difficulty to produce the sound. That is called dysarthria. Main causes are laryngeal diseases, vocal cord lesions, or 10th cranial nerve paralysis. Okay, because of this one, dysarthria can occur. Then apraxia is also a condition where they can't able to produce the language, or they can't able to produce speech sounds. Okay, that is called apraxia. May result from stroke or be developmental and involves inconsistent production of speech sounds and rearranging of sounds in a word. Okay, the proper pronunciation or proper arrangement is not there. Okay, they can't able to construct the word properly. For example, instead of potato, they can talk the topato or totapo. Okay, so like that, the proper organization will not be the difficulty to organize the language. That is called apraxia. Then we'll discuss about the causes. What are the main causes for this speech disorders? My primary factor is unknown. We have seen that in the introduction. It may be due to congenital defects or birth defects or during developmental period of the brain. Then hearing loss. Hearing loss is also affecting the speech, or if you are not properly, if you are not hearing, or if you can't understand the people's voice, then it's very difficult to produce sound. Okay, so hearing loss is also a cause for speech disorder. The neurologic disorders, any trauma or any defect in the brain or nerves. Then brain injury. Then mental retardation, if your brain is not fully developed. Then drug abuse, due to some abuse of drug or use of drugs. Then physical impairments like cleft lip and palate, because palate and lip, these both things are very much important in producing sounds. So if there is any cleft lip or cleft palate, that can lead to defect in speech. Then vocal abuse or misuse, if you are use your voice excessively, or if there is some misuse is there in the voice, that can lead to speech disorders. So these are the common causes. Let us see the symptoms. Depending on the cause of the speech disorder, several symptoms may be present. Common symptoms are experienced by people with speech disorder are repeating sounds. Okay, the main symptom you can see in speech disorder people are they are repeating the sounds. Okay, so that only we have seen that cluttering, stammering, or stuttering, this prosody. This in all these areas you can see in all the types you can see in that they are repeating the sound. Okay, then adding extra sounds and word. Okay, that also I have told this prosody. Okay, they are adding the extra sounds or words. Then making jerky movements while talking. So when we are talking that time, they are making some jerky movement because they are not able to understand the particular speech. Then blinking several times while talking. While talking also they are blinking several times, the blinking of eyes or closing of eyes, because they are getting confused. Visible frustration when trying to communicate. Then when we are start to interact with them, they are having some kind of frustrations, or they are having anxiety to talk with others. Then taking frequent pauses when talking. While talking, they are making so many pauses, or in between the talk there are so many breakage. Okay, that is also a symptom. Distorting sounds when talking. So while talking they are producing some unusual sounds. Okay, that is also a symptom. Hoarseness, raspy or gravelly sounding voice, some harsh sound or rough sound, that is also a symptom of speech disorder. Next is a diagnostic version, how we can diagnose. The proper history is needed for diagnosing speech disorder, because congenital anomalies or birth defect is also a factor. So proper history should be taken. Then a history of any brain injury or any traumatic injury, that also we have to collect. Then physical examination, including head, neck, and laryngeal examination, should be done. So for this one, we can use laryngoscope. We already discussed what is laryngoscope. It is an examination to look at the back of your throat, your voice box, and vocal cord with a scope. With the help of a scope, you can assess your vocal cord or larynx to identify any abnormality. Then mirror examination. Maybe some of you have seen this particular test when if you are when you are consulting with the END. The first and foremost examination is doing is with the help of mirror examination. It is used for visualizing the interior of the larynx and especially the vocal cord. So through the mirror, with a tongue disperser and a mirror forceps is there. Through the mirror forceps, they can see the vocal cord, whether it is swelled or any obstruction is there. Then video stroboscopy. It provides a magnified view of the larynx and stimulates slow motion vibration of the vocal cord. So while stimulating the slow motion of vocal cord, we can identify whether the vocal cord is functioning properly. So we can video stroboscopy means we can directly see in the monitor. Then laryngeal electromyography. It is an electrical activity in the laryngeal muscle. Okay, that is test will helps to identify the electrical activity in the laryngeal muscle, whether the nerves are working properly, the proper reflex is there. These all things we can identify with the help of laryngeal electromyography. Other than this one, voice lab functioning test is there. So it is a computer-based technique used to make voice recording which are analyzed by a computer to obtain quantitative measure of voice abnormality. With the help of a computer, we can do the voice lab functioning. We can record the voices and we can obtain the quantity of the mesh or voice abnormalities. Then reflex testing, okay, gag reflex, laryngeal reflex, okay, swallowing reflex, okay, this whole thing. Then other than this one, X-ray, CT scan, and MRI, it will helps to identify the abnormality, okay, physical or physiological abnormalities, structural abnormalities, and extension of the problem or any brain involvement. This all things we can identify with the help of X-ray, CT scan, and MRI. Then next is Denver Articulation Screening Exam. So articulation is related with pronunciation. So Denver Articulation Screening Examination is the most commonly used testing system to diagnose speech disorder. This test evaluates the clarity in pronunciation in children between the ages of 2 and 7. This 5-minute test uses various exercises to assess the child's speech. So Denver Articulation Screening Exam means it is a particular test. In this test, we can examine the speech disorders. Okay, we can helps to diagnose the speech, what kind of speech disorder they are having, and in this test they are evaluating the clarity in pronunciation. Okay, how much clarity is there in the pronunciation for each word. For we have seen that in some pronunciation problems are there, instead of das they are using gas, or instead of cup they are using tub. Okay, so in order to identify which kind of a speech disorder, we can go through this test, and mainly this test is doing the age group of 2 and 7, and it is a 5-minute test. In the test, various exercises are there. After finishing the exercise, the person can, or the trainer can easily identify what kind of speech disorder is there. The next one, Early Language Milestone Scale 2. This test determines a child's language development. This test can quickly identify delayed speech or language disorder. So there are milestones are there in a child when he is growing up. So the child should achieve the milestone and on proper time. Okay, for each month or each year, there are certain milestones. You will study it in pediatric in detail. So the language ability or the speech ability is also a milestone. So with the help of this milestone scale, we can identify whether the child is having delayed speech ability or they are having early speech milestones. Okay, so that we can identify. Then Peabody Picture Vocabulary Test. It's a revised test. It's a new edition. This test measures a person's vocabulary and ability to speak. Okay, we can identify whether the person is having proper vocabulary or proper. They are using proper words or sounds while talking. The person will listen to various words and choose pictures that describe the words. Okay, so in this test they are giving so many words and pictures, and we will instruct the child or the person to identify the matched words and pictures. So if they are identifying the words and picture properly, then they don't have any speech problems. Or if it is not able to identify, then there will be having some disabilities. People who have severe intellectual disabilities and those who are blind will not able to take this assessment. The Peabody Picture Vocabulary Test has been revised many times since its first version was administered in 1959. From 1959 onwards, this particular test is going on. In this test, they are providing certain images and words, and they are instructing the person to match the words and images. Okay, so if they can't able to do, then some of the speech disorder will be there. Then next we will move into the management or treatment. In that mainly the treatment is speech therapy. In speech language therapy and sleep language pathology, that is called SLP, will work with a child one on one in a small group or directly on a classroom to overcome difficulties involved with a specific disorder. So speech therapy, so that is also a therapy like physiotherapy or occupational therapy. That is also therapy. It is done by sleep language pathologist. So that particular name is person name is sleep language pathologist. They are only identifying the speech disorder and they are giving proper therapy for this disorders. So they will work with the child one on one. One on means individual or in a small group or directly on a classroom. This is a three main type of interactions they are doing with speech disorder children. Either they will interact with them individually one-on-one basis, or in a small group, 4 or 5 people together they will do, or in a classroom. This will helps to identify the specific disorder, and also they are giving training for this disorders. So the indications for speech therapy are hearing impairment. Those who are having hearing impairment, cognitive or developmental delays. If their milestone is delayed, then weak oral muscles. They are having weak oral muscles. They also can't able to produce the sounds properly. Excessive drooling. Okay, drooling means dropping of saliva. So if they are having excessive drooling, then chronic hoarseness. Their sound is getting more loud. Birth defects such as cleft lip or cleft palate, autism. Okay, from childhood itself they are not behaving properly. Motor planning problems. Okay, they are having some muscular abnormalities or weakness in muscles. Then respiratory problems, feeding and swallowing disorder, or traumatic brain injury. So in this type of people only, the sleep language pathologist is providing speech therapy. The strategies used or the methods or the techniques used are: first one, language intervention activities. First one is language intervention activities. A SLP will interact with a child by playing and talking, using pictures, books, objects, or ongoing events to stimulate language development. So in language intervention activities means to produce language. Okay, they are trying to produce language for this, or sounds for this one. They are using various talking measures, with the help of they are playing and talking with the help of pictures, books, objects, or ongoing events. So that time when we are playing this, all you can also examine, or you can also experience the same thing in front of small kids and all. If you are showing some images or some pictures or some objects, okay, definitely they will produce some kind of sound. Okay, so in order to producing this sound or stimulating the this particular development, they are doing this particular activities. The therapist model correct pronunciation and use repetition. So once a child is pronouncing about or they are producing the sound, so that time this speech therapist will help to correct the pronunciation. For example, if they are telling for bat, they are telling tat. So that time the speech therapy will correct that it is not tat, it is bat. Okay, so like that corrections are there. So it will helps to improve their language development. And use repetition exercise to build speech and language skills. Okay, and they are repeatedly they are doing this particular exercises, so it will helps to improve their language skills. So that they are doing in language intervention activities. Second, so here you can see that there are so many stickers and images will be there. So with this help of this one, they will ask what is this and all. So when the pronunciation is coming, that time they will correct it. Then second one is articulation therapy. So those are having problems with pronunciation. For them, the speech therapy is giving articulation therapy. Articulation exercise involve having the therapist model correct sounds and syllable for a child, often during play activities. So here also, during the play activity, the therapist is providing proper direction for or proper instruction of or proper pronunciation of sounds. The level of play is age appropriate and related to child specific needs. According to the child age and need, the play level will be changing. Okay, so they will during the play they will correct the pronunciation so that the child will improve the pronunciations. Then oral motor or feeding and swallowing therapy. So we have seen in the indication those who are having swallowing problem, those who are having weakening in oral muscles, or there is some feeding problems for them also, they are providing the speech therapies. In this one, the SLP will use a variety of oral exercises, including facial massage and various tongue, lip, and jaw exercises to strengthen the muscles of the mouth. So, in this type of method, they are following certain oral exercises to improve or for strengthening the jaw or jaw muscles or lip muscles. It will helps to produce proper sounds. Then next one, potential complication of speech disorder. If you are not properly taking care of the speech disorder, or if you are not treating the speech disorders, then what all things can happen? Untreated speech disorders may cause a person to experience a great deal of anxiety. They will having they are more anxious, or their anxiety level will be high because they can't able to produce proper sound, so they will become more anxious. Then over time this anxiety can trigger anxiety disorders. Then phobia of speaking in public. They will having more fear in front of speaking public. So these are the potential complication can occur in speech disorder. And what are the preventions? Mainly early treatment for anxiety can help prevent the development of anxiety disorder or phobias. So sometimes when they are facing the difficulty to speak, like stuttering or stammering, so that time their anxiety in front of others, when they are getting shame, so that time their anxiety level will be increasing. So proper treatment should be given for the anxiety or phobias. Treatment options include talk therapy and anti-anxiety medications. We have to provide speech therapy or talk therapy. Along with this one, anti-anxiety medicine also we have to give, so the people will become normal. The outlook improves for people who seek early treatment. Early treatment helps prevent a speech disorder from worsening. So, if you are identifying the speech disorder in the early stage of the child life, then it will easy to manage or easy to correct the speech problems. The outlook for those with permanent disability depends upon the severity of the disability. So sometimes the if they are having permanent disability, like some brain tumor or brain injury is there, so that time the severity also will depend on the disability. Okay, so these are the prevention of complications. So early diagnosis and management is very important, and also we have to provide early speech therapies will helps to prevent the worsening of speech disorders. Okay, so this is all about the topic. So today we discuss about what you mean by speech defects. What are the speech defects? There we have seen around 7-8 speech defects we have seen, and what are the causes? What are the signs and symptoms in speech defect? How we can diagnose, and the management. Management mainly speech therapy. In the speech therapy, we have seen what are the various methods or strategies we are using for correcting the speech disorders. So this is all about the topic, and you have to write the nursing management for speech defects. I hope you all of you understand about the topic. Have a nice day. Thank you.